bones in I'll see a baby. Sometimes you call report, I'll say, oh, I don't know, let's go back. I'll say, oh, I won't go back, make my coffee. My I thank God for my life. And I because when I 38 years I thank God for my life.
No, I'm just come and let's take pictures, post it out there.
And I have ulcer in the legs because of the sickle cell. It's in your ulcer. Oh, me nine. Me no Dr. Hanson. Now me ulcer no. Very bad. Sometimes we sound confronting. So we sound confronting man. But we say that is you every midnight. We not good from baby. And sometimes we very same about one thing. Now so I do an mean that because I'm to we call about thing. Any other for chili. But I do an pound who we want one thing that we share them. Not be Susan. Crisis neighbor. I mean, also no. It's not easy. And I got two on my legs. And see, sometimes for the walking it's not easy. But we move Dr. Hanson. Nyankupo Adom. My whole change is very. Nah, me pain simple say me also. Me simple say bibi da me na. Na nyame adom so. Me kro so
in fact, the doctors are doing a lot of things to help her sustain her life, and the National Sickle Cell team with Dr. Mary have arranged and have gone for a lot of help for my daughter. Now we are in the process of providing her with some special shoes so that she can wear and do her daily activities so that she will not have much problem as it was before. Also, they support us financially when we are coming for the clinic. They do support us, they give us money for our TNT and so many other things. Anytime we are sick, when we call on them, they give us attention and direct us on the way we are supposed to go. In fact, this year, Father's Day, they invited me, they gave me a lot of medicines that will help us throughout the year. They have done a lot in our life, and I will say, God bless them. God bless them for what they have done for us in the team of sport.
Like, oh, don't worry, your story will help educate, so let's share. So through her, I was able to tell my story, which will go out and maybe educate someone out there to also feel happy about themselves, live with sickle cell, or like just be okay and not find it difficult approaching people or talking about sickle cell. So I'm grateful for her and the Iscc team. Thank you all.
So we would like to take this opportunity to call on all corporate organizations to help us, support us. The work is big. The patients are a lot. We can't do all by ourselves. We are calling on support. Anyone who has been touched by these stories and wants to support, our doors are open. You can always come.
Touching lives, making their lives better. When I was sitting there and everybody was saying, hey, I've been given a scholarship, I said, hey, why won't they give me the scholarship too? Yeah, because giving scholarships is not easy, but I think that they all kept talking about their health. It's not just their health, their education. Some people talked about some improvements in their mental health. And I think that that's why this is an amazing initiative. So give Airtel Tigo and Iscc a round of applause for this initiative. For more people to contribute, donate, push so that we can get more of these amazing stories.
National Sickle Cell Center, Iscc, is a newly founded organization. It was established last year, March, by myself and my twin sister, Martha Riafi. So many things led to the founding of the Iscc. We realized that 1 in 3 Ghanaians have the sickle cell trait, but many people do not know their genotype, and especially with the women, a lot of them only find out that they have the sickle cell trait during pregnancy. And with a lot of parents, after they've given birth to a child with the disease, then they find out that they've given birth to a child with the disease and they have the sickle cell trait. And this can cause a lot of havoc and issues in families. And it's actually led to some families breaking down because the parents didn't have the needed understanding of sickle cell disease. And some believe sickle cell disease is a death sentence. There are so many misconceptions in society about sickle cell. But then, importantly, we partnered with Airtel Tigo for this educational initiative because I'll use my uncle as an example. Though he came from a good home that could take care of him, my family wasn't educated on the do's and don'ts on how he could live a full life with sickle cell disease. And this led to an early death at the age of 19 years. But then sickle cell disease is no longer a death sentence, and people think it still is. At the Ghana Institute of Clinical Genetics, Kolebu, their oldest patient is 98 years old. So we want to spread that news that when you have the needed medical care, when you're educated, you have the necessary support, you'll be able to live a long and full life, achieve your dreams and goals. And that's why we think education is important. And sickle cell does not discriminate. It doesn't matter whether you are rich, you're poor, wherever you are. Anyone can experience the complications. But then it shouldn't stop you from achieving your life's goals. And that's the hope and the message that we want to give to Ghanaians. We want Ghanaians to be educated. Another experience I had was with a good friend of mine who didn't receive the needed medical care because the doctor had not been educated on ways of managing a patient when they come with a sickle cell complication. And my friend died within 24 hours. He was 28 years. He shouldn't have died. So there's a lot of education for healthcare professionals as well. We need to come together and provide education to the public, healthcare professionals, speak to corporate organizations, to do what we all have to come together to work to break the sickle cell stigma and provide support to those who live with the condition.
Coming into contact with the International Sickle Cell Center is to, one, educate Ghanaians about sickle cell and then see how best we can prevent the disease. And if you are not able to, if let's say couples are not able to prevent it and we have children being born anyways, then we teach them how to manage it so we reduce the mortality rate.
Personally, I've seen how this affects families. I've seen the mother agonizing over how to take care of her child who is in pain, and watching the mother try and find a way to take the pain herself. I've watched two young couples actually try and agonize over whether they should be married or not because one of them had the sickle cell trait. I've watched all of these things and how it affects the economy and the people here in Ghana, because this affects everybody in Ghana, either directly or indirectly. And so we decided that Airtel Tigo had to get involved in something. This was something that made sense to us, and again, because our education was supported by the government, and we are now owned by the government, we thought that this would make a good way of how Airtel Tigo can touch the lives of every Ghanaian involved. So that's why we started this process. It's taken us a year of hard work to put all this together. We're launching today, and over the next couple of weeks, this becomes an educational series for everybody involved in this process. So we hope that this helps to alleviate the situation for the actual sufferers, but also the stigma that comes along with this in the workplace. Sometimes you need a little bit of extra help from your employer. This type of education, we hope, will help to reach the employers as well, the employees and everybody involved in this, so that by touching their lives, we can also show that Airtel Tigo cares about everybody.
But since we met Iscc, they've given us the boldness and the courage to speak for ourselves, to stand in all areas of our life. They have been people. Sorry. My Dr. Mary Anson and her twin sister has been helpful to me and my siblings because they've been taking care of our medication. Now, at first we could not afford it, but right now they have been affording it for us every month. Iscc has given us the boldness to speak and stand and advocate for the Iscc, for the sickle cell disease, because it's not a death sentence, it's disease.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.